Dr. First, let me express our happiness with your existence with us in Cairo Live, the channel of Cairo 24, which is one of the most famous Egyptian news websites. Welcome, sir.
Thank you very much, and it's a great pleasure for me to be here today with you.
How do you see the Egyptian choice to the title of its seventh conference this year about the fatwa and the sustainable development goals, especially when this choice meets with the global economic crisis?
Thank you. That's a great question, and I think globally everybody is quite happy and impressed by the title of this year's session. I think it falls within the details of the Islamic Sharia and law, where it secures humanity, the planet, the earth, and all living beings. So the title and the theme of this year's conference and progress towards the SDGs, I find it extremely positive and optimistic. And it also speaks to another piece, which is partnership. And we will not be able to reach the SDG goals without partnering with all entities within the community. And the scholars and the religious scholars are a crucial part, especially in this region of the world.
Doctor, let me see the opportunity of your presence with us and ask you about the infectious diseases and the relationship between it and the climate change.
Thank you. That is also a very good question. Of course, infectious diseases, we're talking about specific pathogens, bacteria, viruses, fungi. So they're living agents, and the climate change allows for easier spread. For example, if we look at the floods that are taking place around the world, floods allows for more unhygienic water or non-clean water. And within the water, which is sometimes people need to drink, bathe in, it will be a good vehicle to transmit certain pathogens, and cholera is exactly one of them. So climate change is an accelerator for transmission of infectious diseases, and infectious diseases are very difficult to manage because they require very specific tools in diagnosing, treatment, and prevention, and especially in areas where climate change has affected them the most, the means to rebuild becomes more difficult. So the availability of healthcare systems, affordability of medications, vaccines becomes a challenge. So if we talk about the middle and low income countries, climate change has compounded effects on their health, well-being, and specifically we're talking today progress to the SDGs for 2030.
Okay, does that mean that the coming years will witness more of the infectious diseases or more spread to the infectious diseases?
I think if we continue to behave the way we are today, that is going to be the case. But there's always hope and opportunity that by achieving a better planet, a cleaner planet, a safer planet, and also with access to healthcare systems, with improving education, with improving financial independence and education, with better gender equality, with all of those 17 SDGs, there is better hope that we can tackle infectious diseases in a better way.
We hope the world achieve that really. Doctor, you know that Egypt hosts the COP27 coming days, and also this conference concentrates on the climate change. How do you see the Egyptian efforts in this field?
I think Egypt should be very proud, the region should be very proud, and the world is very proud of the participation of Egypt in this very important event, and I'm really looking forward to the outcomes and wishing them all the best and knowing that it will be a great meeting, inshallah.
Doctor, we are so happy that you were with us on Cairo Live. You added a lot of useful information. Have a nice day, and thank you for your time.
Thank you very much for your kind interview. Appreciate it.
Thank you so much.
Have a good day.